Now, a DO, this is a little bit less known. This is a doctor of osteopathic medicine. In the grand comparison of DO versus MD, within the United States, it's the same license. They have the same responsibilities. They have the same different parts to their job that you would find. You can be a surgeon with a DO, you can be a surgeon with an MD, you can be a gastroenterologist with a DO, you can be a gastroenterologist with an MD. The big difference that you'll find here is really in your training. Osteopathic doctors tend to be focused a little bit more on the whole body and the holistic review of it. Now, I think it's important to understand that medicine has gone through a lot of different changes over the last several decades here, last 2 decades in particular, where more and more traditional medical doctors are looking at osteopathic medicine and osteopathic methodology and how they're treating their patients. So that gap between the two is really more narrow now than it ever has been before. Now, becoming an osteopathic doctor or an MD, it's a similar or the same process really, with the only difference being at the medical school level, which degree are you pursuing? Are you pursuing a DO or an MD? So you first need to get your bachelor's degree. Again, with us, I would recommend following our pre-medical and health studies major because of the focus around preparing you for medical school there, and then applying to a medical school of your choice. We do have some internal pathway programs and articulation agreements with several different medical schools out there. If you're interested in that, I'll have our contact information at the end of this presentation. Please reach out. We're always more than happy to explain those details for you. And if you wanted to go into osteopathic medicine, you'll find salary range very similar to an MD, if not identical.